the director of the Health Innovation Initiative at the Bipartisan Policy Center, and also as the executive director of our CEO Council on Health and Innovation. The CEO Council is really an employer-driven effort designed to improve health and healthcare. A little bit about us. In the interest of time, I'm going to go fast. You can see it on the slides. We were actually established in 2007 by former Senate Majority Leaders Howard Baker, Tom Daschle, Bob Dole, and George Mitchell, two of which I think Josh talked about earlier when we just got started. And so this whole area of an outcomes database is really a bipartisan issue and something that we care a lot about at the Bipartisan Policy Center. And I'm really pleased to join Joe Cantor today. I mean, Joe and I have known each other a long time. He provided the first grant. Joe, if you remember, to the eHealth initiative at the time when we were trying to promote, of course, data sharing for public health surveillance purposes, and that's still a problem that we're experiencing today. So in the interest of time, if we can go to the next slide, I'm going to give you a whirlwind, something that would take an hour usually, really quickly. So when we think about the learning health system, what are the big policy issues that need to be addressed? And this is just a subset in the interest of time. And then what's likely to get done this year? And I'm going to go fast and just say it's all about the data, right? Access to data. That's something that we hear from everyone. And I'm pleased to say that I think that we'll see some action on this. We already have. And for those who follow policy, and probably not a lot of people do, something happened in December, actually, in this big omnibus spending bill. Congress actually inserted some language that would prevent folks from information blocking. And that's a big deal because we can't get the information to flow as much as we'd like to. So that's a pretty big deal. It calls for ONC, particularly for its pseudo-regulatory authority around electronic health records, to make sure that those systems are interoperable. The other thing, and this is going on right now as we speak, if you were to go back a year ago, we saw bipartisanship, bicameral, bipartisan, tri-committee, Senate Finance, House Ways and Means, House Energy and Commerce got some agreement on a bill, and I'm going to go quickly, around SGR replacement. And I don't know how many folks on the webinar are aware of this, but the way that we pay doctors under Medicare, we're approaching, by the end of this month, March 31st, another 21% cut to Medicare payments that needs to be avoided. Well, members on both sides of the aisle in 3 committees came up with some replacement language, and there was a lot of information in there about information sharing and avoiding the blocking that happens today that so many of our speakers have talked about, the need to have access to data. And the good news is, now they're keeping it pretty quiet, but on the House side, they're really trying to move that bill forward as we speak. We don't have much time. What's today? It's March 13th. We're only 2 weeks away, but they're working hard to get something done, and this has been published a little bit. It's leaking a little bit, but they've been careful. I think the big issue is how do you pay for this thing? It's billions of dollars, and whether they'll get something through the Senate and fully in the House is unclear, but goodness, a lot of time being spent right now. And again, goodness for us. It would address the way we pay for health care, number one, which is a driver of information sharing, and it'll address information sharing as well. And then in my last couple of minutes, 2 more vehicles to watch. On the House side, Chairman Upton of the House Energy and Commerce Committee has something called 21st Century Cures. They just released a discussion draft, and we see a lot of language. Our placeholder on interoperability, and of course they're looking at getting to real evidence development, the use of data, a lot of the things that you've heard about today, they are promoting, and they're moving fast and furious. 2 meetings a day, bipartisan, and then of course you need something on the Senate side as well as the House side, and Senator Alexander, the chairman of the Senate Health Committee, he and Patty Murray, Senator Murray, have launched a bipartisan working group on the Senate side focusing on the same issues. And in fact, at the BPC on Monday, we are formally launching an effort to inform Senate legislative policy development on accelerating medical innovation. So that's a quick tour. Much more we could talk about, and maybe at a later time. So that's it, and I'll turn it over to our next speaker.
Mr. Joe Cantor.